The first time I went on a mission trip was with one of my mentors, and it turned out to be the same mission trip I've been on now for the past 9 years now. But we go to the same children's hospital in Lima, Peru every year. And so by going to the same hospital each time, there's a real chance to get to know the community, both the physicians and surgeons there, so they can learn what we know and how the complicated surgeries we do. But more incredibly is the families, because we keep seeing the same kids over and over and watch them grow every year. And when we get there, they all come to us like it's a huge family. And then they bring more children and bring their little sisters who have the same diseases or what have you, or little sisters and brothers. And so it really, I think that's especially meaningful for being a pediatric plastic surgeon. A pediatric plastic surgeon reshapes a child's face, a child's body, so they can be more normal. And so the most difficult thing is, as that kid grows, things are going to change on you. And so compared to so many other fields, this is the field you have to follow your results to know what the long-term results are. And if you didn't go back every year to see the kids, how they grow into the surgery, then you would be doing a disservice to them and to yourself. Part of the reason why I keep going back is I want to see the kids again. They're just like my family here at Cardinal Glennon Children's Hospital at St. Louis University, where I see the same families over and over again. Every year on their annual cleft team visits and their annual craniofacial visits. I mean, they're excited to see me, I'm excited to see, wow, another year has passed. And so these kids all tend to have craniofacial disorders, and certain genetic diseases are higher incidence in Peru. So many, for example, many of our children have Cruzon syndrome, and children with Cruzon syndrome have their skulls fused at birth. So when they're before a year of age, we have to cut and move their skull so that their brain has enough room, and cut and move their orbits so that their eyes don't grow out of their homes, so that there's a roof over their eyes. And as they get older, the upper jaw needs to be moved forward too, so they can breathe better and not have sleep apnea anymore. And so that's some of the most common things we do, is move the face, the orbits, and the skull, and the jaws for these kids. We also take care of any pediatric plastic surgery problem there. So we have had kids with Mobius syndrome. They don't have the nerves that move their face. So we'll do tissue transplant of muscles from their legs that you don't need and reattach the arteries and nerves. So now they can move and smile for the kid. They sometimes call that smile surgery. We have moved jaws for kids who can't breathe well, to look more normal, chew more normal, breathe better, cleft lips, cleft palates. But mostly the craniofacial surgery is what makes our mission group very different than other missions. There are many missions that do cleft lip and cleft palate surgery. The group I go with is one of the few that do craniofacial surgery.